Often, any dangerous conditions do not show clear signs and symptoms until they become severe. A timely diagnosis can not only help a check on health, but also helps address any potential complications in a very timely manner. Hi, my name is Rosie Bansal. I'm a fitness enthusiast and a nutritionist. With me today, I have Dr. Vaishali Lokhande from Apollo Hospitals, Navi Mumbai. Welcome, Doctor. Dr. Vaishali is an internal medicine and general physician specialist. She comes with more than 2 decades of experience. Wow, that is so amazing. And with me today, Dr. Vaishali is going to help us understand so many of those questions and answers related to our preventive health checkups. So, Doctor, my first question to you, what is the need of these health checkups? ज़रूरत क्या है हेल्थ चेकअप करने का?
Actually, this need for health checks is felt most by people who land up in the ER with an emergency situation. It has so often times happened that the patient has had some vague niggling signs which they've ignored unfortunately, and then they've come with an acute cardiac event or something.
Okay.
And probably it was, maybe if they had heeded their signals or if they had been careful enough. So the whole idea behind a health checkup is to pick up these silent killers. So diabetes, hypertension, ischemic heart disease, they may not always manifest very frank symptoms. It can be very subtle or it can be easily missed. It has so often happened that patients are hospitalized for fever or something else and they come with the sugars of 500 and they weren't even aware till yesterday. So difficult to believe, but yes, it is how it's happening around. Supposing this patient was aware and had taken care of their condition better, maybe they would have not landed up in the emergency or in the ICU because the infection triggered the whole episode. Okay, so the sugars, if they were well controlled, would not happen. So I believe health checkups are like, you can call it something to insurance. You're insuring against further morbidity or death. All of us like to do our, car ka servicing. All of us get our house pest control done. All of us get our, other things sorted out and we plan our vacations. Unfortunately, the same kind of enthusiasm or concern about our health doesn't remain. So we will spend money like anything on car servicing and getting it upgraded, even our phones for that matter. But what about a health upgradation, version 2, version 3? So health checkups is a nominal charge at which you could know what your blood sugars or your lipids are. Health checkups can pick up abnormal stress tests, and people have had positive stress tests. They've undergone angiographies. The blockages were close to 80-90%. They weren't even aware. The problem being they were not active enough, so they would not have symptoms. Now, if that person had started off some unusual activity, had gone for a trek on a whim or something, he or she would have probably had an event there. Possibility. So my point is stress tests and all these checkups which are done when you are not feeling uncomfortable are the ones which pick up problems. So these health checkups are absolutely the need of the era now.
थैंक यू सो मच डॉक्टर. एंड इनफैक्ट ये भी बहुत सारे हमारे घरों में ही देखा गया है डॉक्टर, दैट लाइक एग्जाम्पल हमारे पेरेंट्स हैं. हमारे पेरेंट्स हेल्थ चेकअप के लिए जाना नहीं चाहते. दे डोंट वांट टू गो फॉर अ चेकअप. दे आर लाइक, हमें क्या हुआ है, वी आर एब्सोल्युटली ओके, देयर इज नथिंग रॉन्ग विद अस, यू गाइस टेक केयर ऑफ योरसेल्व्स. So and this is just one small community, but there are so many other people across also who have this mental block. I mean, I would personally call it a block, that I am physically fit, I go to the gym, I'm absolutely okay, I don't need a health checkup. What is your take on this?
Okay, let me just again, it might sound like I'm harping on the same thing again and again. I'll again give my example of diabetes, favorite example. So, the way earlier hypertension was called a silent killer and 50% population wasn't even aware कि उनको hypertension, data है, statistics है कि 50% people are not aware that they are hypertensive. जो 50% aware है उनका correction भी नहीं हुआ है. They are not taking medication. So, ditto for diabetes, you're doing studies across India, and from data from India shows that almost 40% people are not aware of the diabetes status. And whenever patients come for some reason and they get their checkup done and we do their evaluation for, somebody has 10 years of diabetes, 15 years of diabetes, they end up with problems like retinopathy, where you have problem to the vision and the permanent loss of vision happens. That's called retinopathy. You can have kidney damage, where there's protein loss in urine, and they can have a rise in creatinine, ultimately needing dialysis after a few years.
Absolutely.
So these problems, they don't happen after 10 years of diabetes. They happen eventually, and you don't get it picked up because many patients at the onset of diabetes diagnosis, let's say that patient has had it but never tested, It has so happened in few cases, those changes were there on day one of diagnosis. It's an unfortunate thing because all that could have been done to prevent this problem.
Correct.
All that time is lost, and you cannot do anything about it. It's an undone thing. So that's one thing about diabetes and complications. And there's a condition called pre-diabetes or early diabetes where you have your HbA1c. I'm sure everybody in the world knows about HbA1c now. So HbA1c values between 5.7 to 6.4 are called as pre-diabetics. In fact, in India, almost 20-30% population must be in that range right now. So
that's so scary.
Yeah, it is. It in some states. I was just reading the statistics yesterday only. So in some states, the numbers are close to 20-30%. You know, and metropolitan city areas and urban population setting where there is, abundant access to healthcare, and you have facilities for testing. It's not like rural areas. So urban lifestyle. Despite awareness and despite having the means and infrastructure, there is a lethargy to do these things.
Yeah.
Now, pre-diabetes, going on to diabetes, is something which if you can prevent, you can prevent so much, a whole lot of complications in life. So I feel that is why, sometimes you understand it the hard way, and that is not the way to learn it every single time.
Absolutely.
And it should begin at home. That's why every one of us who's aware should try to encourage these things, because it's like penny saved is penny earned. Similarly, health saved is health earned. I believe that idiom works here also.
Very true. So here, that kind of brings me to my next question. What is this routine screening test? So, क्या test होते हैं ये?
See, basically, what it says is that routine is, okay, you have to know what all organs are affected.
Right.
But commonly, when we are recommending health checkups, you should know what your hemoglobin levels are. That's applicable for every person, right? Because anemia is a commonly prevalent condition despite, again, having good food access. So anemia is one thing. You should know what your lipid profile is, okay? Now, earlier it was a thing that 35-40 cross kiya to checkup karna chahiye. But now, I'm seeing adolescents also. There are youngsters who come for some other problem, and then their parents are getting a bit anxious. So fortunately, that is also one thing that parents have become vigilant, and they have become more aware. And I've seen 17, 18-year-olds coming with HbA1c of 6. It is a scary picture. Okay, so doing your HbA1c, doing your fasting sugars and postprandial sugars, your lipid profile, your thyroid values, vitamin D and B12 deficiencies are a common thing. Getting your hemoglobin workup done. So these are basic screening ones. Then if the person is above 30-35 years of age or has some family history of heart problems, then he or she must enroll for a cardiac evaluation also. So doing a ECG, a 2D echo, a stress test. Again, young girls with abnormal menstrual cycles or something, PCOD is again a common problem. So these can be picked up on an ultrasound. So, but the basic blood work is something I believe everybody should opt for as a what you call a wellness plan.
True, true. In fact, doctor, also at this juncture, I definitely want to share that my husband and I have ensured that, I don't even remember for how many years we've been ensuring that annual health checkup hamara zarur hona chahiye. And you won't believe, we actually do it on our birthday.
That's a very cool thing to do, and many of my patients do that, and I feel it's a very smart reminder, as the years pass by, we are aware of our growing age and possibilities of diseases of old age. So birthday is the right time, it gives us, one thing is a reminder, and then awareness happens and we take the right action. Motivation matters a lot here. In fact, birthdays are a time to introspect also. I mean, you're growing older and wiser, but you're growing healthier also. So you start taking action, you probably change your lifestyle goals and your activities. And all of us should do it. That's a smart thing. And you don't need a reminder from somebody else. Most of us do that. Many of these, in Apollo Hospital, our Pro Health Check program has that reminder thing. And the patient does it, let's say, on the 1st of January this year. Next year, end of December, he or she will get a reminder. So that's a cool thing, because I feel we all are so busy with our lives.
Yes.
Health becomes a backseat priority.
True.
So some reminder from somewhere helps. But yes, I like your idea of birthday thing.
And I think also the birthday thing, why? Because I think that's the best gift you can give yourself.
Exactly.
Good health.
In fact, to your loved ones also, your parents, your siblings, your friends.
Absolutely.
Instead of packing some spa or something as a gift, this is a more useful and relevant
health
one.
checkup karwa lo apna to be safe.
It's the best blessing, I feel.
Very true, very true. Thank you so much, doctor, for answering all of these wonderful questions for us today. So this is here for everybody else who's listening to us. The Apollo Pro Health Program is a unique, end-to-end personalized, proactive health program that brings together predictive health analysis, cutting-edge diagnostics with expert evaluation, and multi-organ assessment. So this is my urge to all of you here. from Dr. Lokhande as well that please बिना डरे अपना प्रिवेंटिव हेल्थ चेकअप जरूर कराएं. एटलीस्ट साल में एक बार कोई एक डेट सेट कर लीजिए. यू आर डूइंग इट फॉर योर गुड, राइट? आप अपने भले के लिए करिए, आप अपने परिवार वालों के भले के लिए करिए. डू इट. And there is no need to be scared. It is to show you the true picture of who you really are. And if you really liked this entire rendezvous and conversation I had with Dr. Vaishali today, please give us a thumbs up and do comment below whatever you felt about this conversation. Do share it with your friends and family as well. Thank you so much. You have a lovely time ahead. Stay fit, stay healthy, stay safe.